Then let's get started. So let's welcome the first finalist. The company is called ASANA WEARTECH, and it will be Carlos Sánchez Mendoza presenting. So Carlos, please, the floor is yours.
Good afternoon, South Summit. I'm so happy to be here with you today in this lovely city of Madrid. My name is Carlos. I am the CEO of ASANA WEARTECH, which is a very young company with a very novel concept of wearable 3D posture monitors and trainers. Lots of people would like to improve their posture. Some people go to yoga or Pilates to get better postural habits, and some even go to physiotherapy. But when nobody watches, the body naturally wants to go back to what it feels naturally for some reason as a proper posture. And nobody is more compelled to keep good posture than patients with scoliosis. Bad posture sustained over years in these patients can worsen their condition, and that's why we use braces. Braces work by making natural posture painful, 23 hours a day for 2 or 3 years. Isn't this a little too drastic? You have technology in your pockets that is capable of knowing its own posture, vertical versus horizontal. We have scaled up this technology, and we have developed artificial intelligence that is capable of evaluating posture in real time. We have a wearable device that can give the patient feedback in real time and remind them to keep posture around the clock. Initially, we will penetrate this very specific market through an established distributor, and we will make the bulk of our revenue from a software-as-a-service model. The monthly subscription fee will give access to parents and physiotherapists to compliance tracking information, and for the patient, complying will be a game through a gamified platform. The venture is steered by a top-class international business board, and we have with us key opinion leaders in the scoliosis domain. We're looking for talent today, talented engineers with expertise in electronics, software and firmware engineering, and machine learning. It's a huge market, €3 billion market, only in scoliosis. But we also, in our overarching vision, want to help everybody that wants to keep good posture. Once we have a wearable device that is affordable and can reconstruct the surface of the body in 3D in real time and portably, we will open a platform for other developers. In the time of big data, sensing technology is what makes the difference. In ASANA WEARTECH, we're determined to open the gates to ubiquitous capture of human movement and the unprecedented insights that may be derived from this long-forsaken piece of the quantified self. We're ASANA WEARTECH. Thank you.
Thank you, Carlos. Any question from the members of the jury?
Hello? Yeah. Here. User engagement in this kind of products, one of the most difficult things is to make people using and keeping using the product. How do you engage the users? How do you engage the customers?
I need you to repeat the question, please.
How do you engage your users, your customers, to keep using the product?
So we haven't developed that part of the product yet. We think the most important part is to have information. If you have information, for example, from a digital balance, from a scale, that will already help you get better in keeping your weight down. We think that the technological challenge is to have posture recorded ambulatorially, and then gamification is a well-developed field that we will just borrow from in the future once we develop the platform.
Just ask another question. So the product is not completely developed. What is done? What has to be done? of a product, what has been done already and what has to be done?
So the main competition in the scoliosis domain are flexible braces, who follow the same principle using straps and buckles. In the consumer market, there's a Brouch that beeps when you slouch. It has a lot of imprecisions because it's not measuring deformations. When you only have one sensor, you're only measuring where the body is facing. We want to propose many sensors and the readings combined to have a very accurate, more expensive solution for people who have a real problem.
Thank you very much. Well,
Thank you.
unfortunately, we don't have more time. Thanks.